Hi, my name is Travis Prunty. Today we are going to do vital signs, and I will have my patient Luke. He was over here to the right, and we're going to teach you how to do vital signs on a patient. Hi, my name is Travis. We're doing our vital signs health assessment video. We normally, when we have a patient Luke here, he would walk into the room. We'd start a health history on the patient. So I would introduce myself to the patient. Hi, Luke. How are you?
I'm good.
I would first like to start off by asking why are you here today?
It's just a normal checkup.
Okay. Is there anything that's been bugging you? Any injuries or anything like that?
No.
Have you had any surgeries in the past few months?
No.
Do you have any allergies?
No.
All right. Do you have any family history of any diseases that are in your family?
Cancer.
Cancer. Okay. We'll look into that later. All right. So normally, if you have anything like that, you'd write that down in your notes that the patient has a family history of cancer, which could be related to other factors in the assessment from what you find from other results. So okay. Now we also asked if you're taking any medications.
Advil.
Okay. Why are you taking Advil?
Because I have chest pain.
Okay, that's interesting. When have you been having chest pains?
In the past week.
Really? Where have you had chest pains?
Right here.
Right there. Okay. We probably would do from here. We'd probably do hearing that we would do a cardiac assessment, and then we'd ask the patient how long he's been taking the Advil and why. Okay. So from here we would finish up our assessment of the patient, and we'd ask the patient. All right. So I will start with height. So we would ask the patient to take off his shoes. Then we would have the patient step over here onto the scale, and then stand up straight, back ball, hands to the side. Okay. Usually you get your readings. You can get your readings in kilograms or pounds, and then if it was in kilograms, to convert it to pounds, you multiply it times 2.2. So if his weight was 50 or 60 kilograms, you multiply that times 2.2, and be roughly 125 pounds. So okay, you have him step off the scale. All right. Now from here we would have him keep his shoes off, and we walk over and have him stand up and have him take his height. You have him keep his feet flat on the ground, his shoulders back, and his head straight. You measure off the top of his head. Here we'd see that he is 4 foot tall. Okay, and from there we would jot all this information down, and then we would continue over and we would start washing our hands. So I would go to the sink. And I would enter the sink, and you'd want to do it for a good amount of time, so you would lather up, make sure you get a lot of soap on your hands, and you want to do enough time where something that can help engage in your head is sing the happy birthday song twice in your head. So you just go and get it all and lather it all up, and all that with water, and you get nice and everywhere, and make sure you rinse it off, and then we would continue our assessment from there. Part of the video, we are going to take our patient's temperature. So we would get a thermometer. We could take it orally, under the armpit, or rectally. So our patient has volunteered to take it rectally, but we decided not to do that. So we're going to take it orally. Oral is usually the most common preferred method. You usually don't take it rectal unless the patient is subdued or in a comatose state. And under the armpit is only preferred if there's not a sterile method, because armpit's usually not as accurate. So we have him open his mouth, stick the thermometer underneath his tongue. And have him close his mouth and wait for the reading. While you're waiting, I'll just let you know the normal temperature range for is 37 degrees Celsius, which is 98.6 degrees Fahrenheit. That's normal. The range is from 35.8 to 37.3 degrees Celsius, or 96.4 to 99.1 degrees Fahrenheit. Anything above that would be anything higher than normal could indicate a fever, which would indicate some kind of illness. So you could jot that down. That'd be something that would be useful in your assessment. Or anything lower than that could also be indicated of some kind of condition or illness. So the temperatures are a very important reading. Also, something to note for would be if they have a really low temperature, it would be hypothermia, or a really high temperature would be hyperthermia. Okay. And then now we will take our patient's temperature out, and you take the reading, you shake it off, look at it, and then you jot it down. All right. Okay, for the next part, we're going to take our patient's pulse. You want to listen. The four things with pulse are rate, rhythm, force, and elasticity. There are 6 or so different places you want to take the pulse: radial pulse, brachial pulse, femoral, which is on the between on the leg joints, right in the groin area. Popliteal, which is behind the knee. Dorsal medius, which is between the toes, and then posterior tibial is on the side of the foot, on the bony part of the side of the foot. Normally, you would take the radial pulse. You wouldn't do all those unless you're doing a full cardiovascular assessment. So you would take the radial pulse. You would, when you take the radial pulse, you want to take it with 2 fingers wrapped around the hand. You want to feel and not use the thumb, because the thumb can also have a heartbeat. So you don't want to use the thumb. So you take it with pulse, and you want to take it for 30 seconds, and then multiply it times 2. And that would be your the pulse for the patient. So that would be the rate. Normal rate of a patient is between 60 and 100 beats per minute. Normal 60 and 100 beats per minute. You want to listen and feel for the pulse at the same time. So use your stethoscope to listen and feel for the pulse. With the rhythm is how irregular the heart sounds. So if there's any, like, it could indicate a murmur or something like that. If how like the lub dubs were sounding, if they were like they're skipping a beat or anything else. So rhythm indicates how smoothly the sounds sound. So any irregularities can indicate a problem. Force is how strong the actual pulsation is. So 3+ being a super strong bounding pulsation, 2+ being normal. Even pulsation, 1+ being very weak, hard to find pulse, and 0 being no pulse. Obviously, 0 would indicative normally of death, or someone who's not her heart stopped. So normally you write that down in your chart, whether it's 3+, 2+, or 1+, and then you also have elasticity, and elasticity would indicate the feel of the veins. Are they rigid? Are they hard? And this and they popping out. This can indicate different conditions, how elastic they are, and they can indicate future problems involving blood pressure, and the heart. All right, for the next part of the assessment, we are going to do respirations. Normal range for respirations is about 10 to 20 respirations per minute. There's not an exact set, but usually it's about 10 to 20 respirations per minute. You normally don't want to tell the patient you're doing a respiration assessment. You kind of want to do it during the assessment, because if you tell someone you're going to look at the respirations, a lot of times they'll breathe differently and they'll think about it. So during this, you would you just notice, see how calm they are. Or usually you could take it also while taking the pulse, or look at how many respirations they're taking. You want to look also for symmetrical expansion, see if their chest, when they breathe in and out, is evenly expanding. You can do this during pulse assessment when you take the different pulses. You can notice that and ask when you ask them to breathe in and out for if you're taking when you're listening for heart sounds. But yeah, you want to look and see and make sure everything is even. Uneven expansion can be an indication of like a pneumothorax or other conditions like in the heart. In the lungs. So and then also too, you want to notice the patient's position. Are they bent over? Are they sitting up straight? Do they have labored breathing? Are their muscles tensing up so like all these things could be indications of other problems that you can find in this basic assessment. So the patient position is very important. I know one common is the tripod position, where they're all resting over on all things. There's a lot of times this is just because their muscles they're trying to use their muscles to help breathe, so they're having trouble breathing. So these are the things you check for in the respiration assessment. Okay, for the last section, we are going to do blood pressure. For the first part of blood pressure, we will talk about cuff size. You want to use a cuff that fits the patient's arm. Sometimes you have bigger patients, like football players or something, you have to have a bigger cuff. Your arm won't fit because if your cuff is too tight or too loose, it'll give a false high reading or a false low reading. So to measure the cuff, you want it to cover at least 60% of the patient's arm, and it should be about 40% circumference-wise. So you put the cuff on the patient, have their arm facing, with palm up, and you want the arm about heart level, and then sitting in the chair. You want their feet flat on the ground, not crossed, and you don't want them like squeezing any fists or drinking anything or anything like that, and anything that could affect their blood pressure. So to have them relax, you put the cuff on about 1 inch above the brachial artery. About 1 inch above the brachial artery. You want to put it on, make sure it's nice. It's enough where you can move it a little bit, but it's not too tight that you can't. It gives a false high reading. So you want to get it right 1 inch above the brachial artery, palm facing up. Then you have the stethoscope. You put it on. You have the bell side, and you have the diaphragm side. Most commonly practiced people use the diaphragm side, but you're supposed to use the bell side for low pitch sounds. You put the stethoscope on, and you listen. You get their pulse, their radial pulse, and you put their listen to their brachial artery for pulse. You listen, and you increase the pressure on the cuff until the usually 20 to 30 millimeters of over what is normal for them. So you ask the patient like what to expect. Like normally, is your blood pressure high or low? And so if their blood pressure is normally around 150, you do it around 170 or so, and you pump it up above that. So I pump this up, and I would listen. I'm listening for heart sound, listening for the heartbeat and feeling for it to go away. And then once it goes away, I start releasing the pressure of the cuff and letting the air come out slowly. And I'm listening for the heart sound to come back. So you put pressure here, and then you'll hear the beat. And when you hear the first beat, that's the when you hear the first beat after it comes back, that's this systolic pressure. And then you keep listening until the beats are smooth and even, and everything the sounds stop. And then that's where you put your diastolic pressure. Gold standard blood pressure is normally 120 over 80. That's gold standard blood pressure, and that's what we're trying to shoot for. Anything above, like anything in the 140 range or higher is usually a sign of prehypertension or hypertension or high blood pressure. Anything lower than that can be hypotension, which is low blood pressure. And these readings will be recorded, and they would be useful for other things. And that is the conclusion of the vital signs video.